Thank you, Chair Sanders. This committee has covered the shortages of physicians and other health workers extensively. Shortages hurt the delivery of health care in all communities. My home state, Louisiana, projected to have the third worst shortage of physicians of any state by 2030. We need more doctors, particularly in the underserved areas lacking sufficient health care resources. My practice as a physician was for 25 years in a hospital serving the uninsured and the poorly insured, which is to say Medicaid. So this is something which I have spent my professional life attempting to address. Today, we're going to look specifically at minority doctors and health professionals underrepresented in our healthcare system. For example, African American physicians account for only 8% of all physicians, despite comprising 13.6% of the population. Now, if you're listening carefully, you'll note that my statistics are different than the chair's. His is 5% and mine's 8%. My data is more, he uses the Association of American Medical Colleges 2019 data, and I am using the Bureau of Labor Statistics, which is 2022 data. That's important. 2019, 2022. Government data, a little bit more up to date, a little bit more valid. Maybe there's progress being made. And as we look at something which needs to be addressed, we can also say that if we've gone from 5 to 8%, there may be progress being made, and that is a good thing. But it's interesting to note that this disparity is not felt across all minorities. Asian doctors account for 22% of all physicians, but are only 6.8% of the population. And this is an important nuance as we address the situation. It's also important to note, as the chair notes, that we have a limited number of GME residency slots to train new doctors. And these residency positions are not allocated or dispersed to reflect where underserved communities are. Unfortunately, this topic is under finance jurisdiction, but it's an important context and needs to be considered in any conversation about addressing healthcare workforce shortage. It's kind of a truism that a physician will practice within 100 miles of where she or he does their residency. If the residency spot is not in an underserved area, it's not going to be within that 100 miles. But access to opportunity is crucial. I want to highlight, brag on, Xavier University, a historically black college and university in my state of Louisiana. This week they announced an agreement with Ochsner Health to open a medical school in New Orleans at Xavier. And many of the doctors trained at Xavier, which has had a traditional mission to serve the underserved and to provide opportunity for minorities, they will stay in Louisiana and go elsewhere to serve those populations. So I'm proud of Xavier, and I look forward to continuing to support their effort. Now, as a doctor, I am so aware and desire to support those nurses who have climbed the career ladder by building credentials over time through upskilling. Despite from benefiting the individual, it benefits the capabilities of our workforce. It also benefits their family, as their child sees the impact of their mother or father seeking through education and delayed gratification greater opportunity that results in more prosperity. There's a woman I worked with named Olive who went from a nurse's assistant to a LPN to an RN to a nurse manager, and the clinic in which she formerly was the NA, she ultimately ended up being the manager of. Incredible story. We will have someone here today with a similar story. Dr. Jonas Andrades will tell us how she has done that in her career, and that is something that we need to think how to enable. We should also look at other challenges to ensure our healthcare system meets the need of all, especially the underserved. Making sure that patients from all walks of life can participate in clinical trials, which oftentimes gives the most advanced treatment to those who have the most advanced disease. And as I mentioned from my career, making sure that all have high-quality medical treatment is something I am passionate about. One of our witnesses today, Dr. Brian Stone, will tell us how he is trying to address these issues in his community. The committee will also discuss maternal mortality, a topic incredibly important that has been a priority of mine in Congress, and it's important to acknowledge that this issue disproportionately affects African Americans. As a doctor, again, who worked in Louisiana's charity hospital system, I know this community from my practice, and I know that this community is at high risk. That's why I'm pleased to have U.S. Representative and Dr. Michael Burgess testifying. He's an OBGYN who stayed up many nights delivering medical care to pregnant moms and their babies in an underserved population of Dallas. Now, as a legislator, Dr. Burgess is a leader in addressing racial disparities in healthcare, and it's been an honor to work with him on legislation specifically tackling maternal mortality. We were unaware that we were having a members of Congress panel until Sunday, so we greatly appreciate him joining us on short notice when actually they were adjourned last night. His participation helps make clear that Congress understands the severity of the issue and is working to address. I'm also proud to have led several bipartisan legislative efforts to improve maternal mortality and reduce healthcare disparities. In 2022, Congress passed the Maternal Health Quality Improvement Act, which helps address maternal mortality, particularly that disparity within African Americans. It also supports research examining the best practices to reduce and prevent racial discrimination in the American healthcare system. The same year, Congress passed my legislation, the John Lewis National Institute on Minority Health and Health Disparities Research Endowment Revitalization Act. It's a mouthful, but it's a good piece of legislation that provided funding to institutions, including Xavier, to conduct research and address minority health disparities. And last year, in this committee, we passed the Preventing Maternal Deaths Reauthorization Act, the legislation led in the House by Dr. Burgess, and the bill directs the CDC to provide hospitals and other providers information on best practices to prevent maternal mortality. This reauthorization has not yet become law, but we're pushing for passage as Congress. All this work shows a bipartisan commitment in Congress to addressing health disparities, but there's more to do. The Connected Maternal Online Monitoring Systems, or the Connected Mom Act, Senator Butler, I was about to demote you or promote you by calling you doctor, which I introduced with Senator Hassan of New Hampshire of this committee, promotes Medicaid coverage of remote monitoring technologies for those who are pregnant at higher risk of complications. The need for moms in underserved urban or rural areas to travel, sometimes hours, on public transportation to a doctor's office can be a major impediment to care. This legislation allows a physician to remotely monitor her health, watching for indicators of potential complications. It's bipartisan, it improves access to crucial health care for moms, and it prevents maternal deaths. While this bill is in finance jurisdiction, I look forward to the discussion today on how we can continue to make progress on maternal mortality in the HELP Committee. Thanks to our witnesses for being here and providing your expertise on how we better address these important issues. With that, I yield.